Well, good morning. This is an opportunity to visit, have a conversation with Dr. Ann Zink. Dr. Zink is Alaska's Chief Medical Officer. Um, I think it's fair to say that Dr. Zink has probably been in the news more than most Alaskans, even more than most of our politicians this year, as she has really led the effort in the state as we are dealing with and addressing the impacts of COVID-19. We continue to see levels of outbreak around our state that remind us that we are not done with this virus by any stretch of the imagination. But when we are able to get clear guidance, clear advice, and delivered in a way that I think instills confidence and trust. This is an important part of how we as Alaskans can address this pandemic that has impacted us here in our country and of course globally. So Dr. Zink, I just want to thank you for being part of the conversation this morning, but more broadly for your leadership for the state of Alaska and really nationwide. You have been extraordinarily important throughout all of this. I guess let's just start off the conversation this morning by an update on the current state of play as it relates to COVID-19 in Alaska. As with other states, we are seeing an increase, and I think it's fair to say that what we've seen here in the state in recent days and weeks has been unprecedented. So if you want to just start off, we'll start the conversation there.
Awesome. Thank you so much, Senator, for having me today and for Alaskans tuning in and listening to what's happening, both with COVID and vaccination in general. I think they're really important topics. And, the job of DHSS at the state is really promoting the health and well-being of Alaskans. And right now, COVID is a huge challenge to that. We have a real acceleration of cases. Alaska is the third in the nation now for number of cases per 100,000. We continue to climb steeply. We have 380 new Alaskans diagnosed today with COVID that we're reporting out. We continue to see hospitalizations and unfortunately deaths now starting to climb as well. Alaska did an amazing job collectively working together to really prevent the spread early on. And when we compared ourselves to other states in the nation and other peer-like states, many lives were saved because of the collective action of Alaskans working together. But we know that when we're in indoor spaces and confined settings, that this virus takes off. And as the weather has changed and the snow has fallen, it's cold and people are moving indoors, and COVID fatigue is real. And we're seeing that across our state, and we're seeing cases rise because of it. And so as we're really facing a very challenging time in our state, we need to remember that prevention works, that masks work, that distance work, and we need to do it collectively. There's no one magic answer. It's a series of tools that we use in collection to really slow the spread. And there's no one policy, no one person, no one thing that's going to make this go away. It's going to be all Alaskans working together. We know how to prepare for the winter. We know how to do hard things. And we need Alaskans to do hard things right now and to really pull back and slow the spread of this disease. Our hospital capacity is becoming strained. And this could be a really tough fall and winter for us if we don't all individually change our actions now.
So it really is the same advice that we have been receiving for months now. It is social distancing. It is wearing a mask. It is following the guidance in terms of washing your hands and just practicing good hygiene. So that hasn't changed. That is still the initiative that we all need to undertake, regardless of how tired we are of being in our own little social bubbles. This is what is going to make the difference for us. We've talked about the fatigue, and really what that means when you get tired of doing the same thing and you feel like you haven't seen different results. And we have had an opportunity to talk about how, as Alaskans, we are pretty resilient.
Mm-hmm.
We get that we have to do things that we don't like sometimes. And this is clearly one of those situations where we've got to keep doing things that we don't like. And I guess the important message with us right now is to recognize that the protocols and the guidance haven't changed.
Mm-hmm.
Our numbers are not where we want them to be. In fact, we're going in a direction that all of us had hoped we wouldn't see. The outbreaks that we're seeing in rural Alaska right now are quite concerning to all of us, because we recognize that we have much more limited capacity out there, and you also have vulnerabilities among Alaska Native peoples that also present other challenges. We know what we're supposed to do.
Mm-hmm.
We've got to do the hard job. If you're somebody who's out in one of these rural communities that's literally on lockdown right now, what advice and guidance are you giving those out in the villages? Is it any different than what you're saying to do here in Anchorage?
Yeah, no, I appreciate that question. I think some things have to be different. If you don't have running water and sewer, it's hard to say wash your hands in the same way.
Yep.
And so I think we need to recognize the challenges, limitations. If you have 15 people living in 2 rooms, it's hard to stay in your own separate place. There are just physical limitations that are there. I think the big things that I would say is that many of our rural communities have really been able to slow the spread by, quarantining before people come in, testing before people come in, but those restrictions on travel are not sufficient. They're not alone enough. No one single thing is going to protect it. And we need to create kind of speed bumps or potholes in the road of COVID to slow things down. And so testing when you're traveling between places is important, but so is also minimizing your interaction for the 7 to 14 days afterwards, depending if you're getting a test. So if you have to come into Anchorage to get medical care and you get tested at the airport and you're negative, for the week or 2 after there, don't go mixing with other people. Don't go have a card game. Stay away from others. Masks work. There was some great information shared with us from CDC the other day that showed a 79% decrease in transmission within households when people were wearing a mask. So if you are in a community where you have community transmission going on, even a mask in your house can help slow the spread of disease in that house and protect those who are more vulnerable. So, if I lived in a community that is isolated, I got a lot of people in my house and I've got COVID in that community, I would recommend having a mask on both in and out of the house. Also, not having our kids be playing together. So kids love to play together, but we gotta hold them back right now. We can teach them other traditions. We can spend quality time with them in a different way. I sat down with my kids before this pandemic and before this fall actually, and got worse, and said, how do you want to be resilient this year? What are you going to learn about resiliency? And that's going to mean not seeing your friends. And that's going to mean really different interactions. So what ways can we be closer as a family unit, which is going to mean being further from your friends? And so what ways can we build on that? I am concerned about the mental health of our communities as well. And I think it's important to know that this will not last forever. We know winter won't last forever, but we prepare for it. We plan for it. And I think just like winter, COVID, if we plan and prepare on how to mitigate it, we will be safer and we will be more prepared. And just like the sun returns in the spring and the fall and the summer, I think that come spring equinox and summer solstice, we will be in a different place. And so while it feels dark right now, and it feels like every day is getting shorter because it is, and it feels like every day the numbers are getting larger because they are, we also know that the tide will change. And just like we make it through the winter, we need to make it through COVID by doing the things we know how to do: prepare, plan, take care of each other, stay distanced, wash your hands, wear a mask.
That's a really good reminder. And truly, we all understand that as winter approaches, we do have just kind of a different mindset, but so much of it is just knowing that, well, this is this block of time where our days are shorter, it is colder, it is darker, and that is our reality. And we deal differently with it, and we will deal differently with COVID as well. You and I had an opportunity to talk about some of the traditions that we look forward to, family gatherings at Thanksgiving or Christmas and the holidays. And just like your message that you gave to your kids about, how do we want to look back on this and say this was how we were resilient? This perhaps is a challenge to us as families to have that same conversation. We always go to mom's house for Thanksgiving, and there's 30 of us, and you always make the pie and you always do the turkey. Maybe this year is not one of those always. Maybe this is one year where we say, it's been 2020. We're just going to kind of mix it up. We're going to have a really quiet, beautiful fish dinner with a Caesar salad this year or something. I don't know. But it's going to require us to think differently about it. And as we accept, I think, our role in this fight and what we can do individually and as families and as communities to get on top of this, it's going to require doing things a little bit differently. And rather than be discouraged about what you're missing out on, maybe we need to recalibrate that and say, well, this is fun, this is different. I mean, it's different, but accept and embrace the fact that we're going to do it a little bit differently this year. And next year, when the sun comes back, we'll have an opportunity to sit with 30 people and have the turkey and have the pie and do those traditions. But it's a challenge for us. So let's shift a little bit because we're talking about COVID and how different that is. But every year around this time, we deal with seasonal influenza. We deal with the flu coming in, and the need, again, to get a flu vaccine. And perhaps if you can discuss why it's even more important than usual to get a flu vaccine this year as we're dealing with COVID as well. Because, you have some people for whom they say, oh gosh, I never bother with a flu shot. I never have any problems with it, or I'm too young, or I'm too old, or whatever. There's a range of issues. But can you speak a little bit about why you feel it's extra important this year to go get that flu shot?
Yeah, no, I appreciate it. There are some people who truly can't. They've had a bad reaction. They are currently undergoing chemotherapy. And so there are some people who really can't. No shame there. But for all of us that can, we all have to step in and do our part. So a couple different reasons. First of all, COVID and flu can look very, very similar. And so you might have a runny nose, congestion. Right now, we're really trying to make sure COVID's not spreading. And so you will be out of work, or your kid might not be able to go to school because they're not feeling well. So the more we can minimize flu. We also have really limited healthcare capacity in Alaska. And if you've ever had to wait in the emergency department for an admission, if you've ever had to be transferred to another hospital, you know what that means. You know that we have limited capacity. I mean, just yesterday, we had no ICU beds in Matsu and 5 in Anchorage, overall. So we're full. We're really full right now. Only just about 8% are COVID related, but still we have limited capacity. The flu vaccine decreases your chance of needing ICU care by 83%. So when we talk about those beds and needing to keep those beds open, that flu vaccine is an important tool to minimize your chance of needing hospitalization or potentially dying for you. And then it also minimizes the chance that we could spread it to others. And so those people who can't get a flu vaccine because they, again, are undergoing chemotherapy or other reasons, when we collectively all do our part, flu can't move from person to person if it can't get a hold. And so if we can keep those numbers down, if we can all do our part, it makes a really big difference. Protect us, be able to understand what's COVID versus flu, keep our beds open, and protect those who are vulnerable in our community.
And so for those who would say, well, I've gotten the flu shot before, but then I still got the flu. And so therefore, I just don't really think it's that effective. I think we recognize that in fact, it is not 100% effective, but what you're sharing is that, well, it might not keep you from getting the flu. How you respond to that flu virus it's going to be a little bit easier for you to get through it if you have had the flu vaccine. And so it's not only, this is one way that we can stop the spread of that, but if you do get it, your reaction will typically be less severe, less difficult, less complicated.
Exactly. Again, like seatbelts, we know that people still die in car accidents even when they have seatbelts on, but we know that seatbelts decrease the risk of a serious injury if you're in a car accident and decrease the chance that you'd be severely injured. So just the
Yeah.
same as a seatbelt, a flu vaccine minimizes. It's not 100%. Very few things in medicine are 100%. And so each of these things are layered, and a flu vaccine is a helpful tool, even though it's not perfect. The other thing I'd say as a clinician, I see people who come in all the time and they say, oh, I have the flu. And I'm like, you have a cold, and that could be from a different coronavirus. That could be from rhinovirus. That can be from a whole series of viruses. I think in general, we've done a disservice in medicine by saying it's just a virus. Coronavirus is, a virus. HIV is a virus. Hepatitis is a virus. So viruses kill. They can also be quite mild. And we need to always be supporting our immune system. We always need to be taking care of our physical health and mental health. Those things don't go away with a vaccine. You still need to be making sure your immune system's strong and robust. However, and a vaccine it's like a seatbelt. It's another important tool that we can use to minimize the risk.
So, that's one of the questions that we've gotten. We get questions from folks on our social media, and one individual raised the concern. She says that the flu vaccines are the most dangerous vaccines in the United States, and that scientists have never been able to master the perfect flu vaccine because they're only 60 to 70% effective. How safe is the flu vaccine, and why is it still important to receive it even though it's not 100%? So you've clearly responded to the fact that, look, yeah, none of these vaccines are going to be 100%, and you've outlined clearly why it is important. I've actually heard from some that the vaccine, the flu vaccine this year, is just a tougher one. And when I say that, I want to make sure that I share what I have heard correctly, and that is that people have gotten it and have just felt lousy after they got it, and so have concluded that somehow or other this is making them sick. Can you speak to that? Would the flu vaccine make a person sick?
Well, it's a great question. So what a flu vaccine is, it's little tiny bits of the flu virus, usually a non-live bits, just little kind of markers of it. And that's injected usually into the arm or into the kid, into a leg. It can also be done nasally, but that one's a live vaccine. So most of us are getting what we call a non-live or attenuated vaccine in our arm. And that is just like this little representation of the flu that allows your body to see what the flu looks like that year, or what we think the flu, which strains are going to be circulating, and mount a response. And so if you get a sore arm, if you're not feeling well for a couple days, that's actually a really good sign. That means that your body is doing the strong response to shit. So I just got my vaccine the other day. My arm was sore for a couple days. I always get it in my non-dominant arm because I want to be able to use my other one. And that's a sign that your body's working. It's doing its job to build up the response system that it needs to. So I would just reassure yourself, just like, when a little kid gets stitches, I always tell them, like, that's your body going to do the hard work putting that together. That's your body doing the hard work mounting the response. We're not actually giving you the response. We're giving your body the signal of what it needs to do to mount the response, so your body can do the hard work to actually attack the flu once you're exposed to it. And just like you want to support your body when it's not feeling well from any other exposure, you want to support your body then too. So if you're more tired, sleep, drink plenty of fluids, make sure you're eating healthy fruits and vegetables and taking care of your health after you get the flu shot or whenever you're exposed. We want to make sure that we're supporting our normal immune system, because this is just it's a trigger for our normal immune system to be ready to go once it sees the flu.
It's a good explanation. I saw in an article a few days ago that we're doing better this year. The statistic that I saw was that our flu shots here in the state between September and October 20th have been significantly higher. That in 2018, there were 84,000 flu shots, 2019, 95,000, and in 2020, up through the 20th of the month here, 117,000. So your message is getting across about getting that flu shot. I think that is important. And then last point on flu shots is the timing. And why it's important to get the flu shot in the fall, September, October, and then if you can speak to the fact of, well, what happens if it's December and I didn't get one? Should I or shouldn't I? Because I hear folks saying, well, I didn't get it in October, and so I guess I'm too late for this year.
Yeah, it's a great question. Yeah, it's a bit of a timing act, a little bit of a balance in general. And so it takes about 2 weeks for your body to mount a really good response. And so you want your body to be prepared if it sees flu. And so you want to get it before you're in the middle of the flu season if you can. And so that's why usually CDC recommends by the end of October, because usually we're starting to see an uptake in cases come November, December. But your body doesn't remember that immune for a long time. And so it starts to fade off, particularly as the spring comes on. So the longer after your vaccine, it starts to fade off. So a couple different things. It's never too late to get your flu shot. So even if you missed it in October, November, December, it's never too late to get it. We try not to get people to get it too early because we'd hate for their immunity to wear off and then have a big spring peak at the same time. So right now is a great time to get it. I would say this year we're seeing very low cases of influenza right now. So we do a flu report every week. We follow all these infectious diseases closely, and we're seeing very, very few cases. And so it is definitely not, it's never too late, but now is a great time to get it because we really have not seen that uptake and spike. The other thing I might just add is that particularly people over 65 should get the high dose flu vaccine. That has been really limited across the state and across the country. As lots of people over 65 are getting the flu vaccine. A regular flu vaccine works very well, even in people over 65. And so if you can't get access to the high dose flu vaccine, I would recommend getting the flu vaccine regardless. So that's another question I get quite a bit.
So how would you even know whether there is a high dose for that year, or is there always a high dose and a regular dose?
Yeah, we try to make sure at different centers that there are both vaccines available. There's a whole series of vaccines. There's ones that are grown egg-free for people who have egg allergies. There's nasal ones for kids who are concerned about shots. And then, if you go to like a bunch of pharmacies, they'll often have high dose or non-high dose vaccine. It's more important to get vaccinated than it is to have high dose versus non-high dose. So I really want to make sure those are over 65 are getting vaccinated, even if in their community they're not seeing high dose right now.
And I think it's important to remind people how accessible the flu vaccine is. You can pretty much go to any pharmacy, any clinic, covered through insurance. If you do not have insurance, again, you can be eligible for flu shots. You and your child may be eligible for CDC's vaccine for children, but the cost issue should never be a barrier here. And I think it's important to recognize that these free flu clinics and the availability are there, and we need to really try to access them. I want to pivot a little bit to kids' vaccines then, because when we think about vaccines, most of us that have had children remember that whole series shortly after birth and in their early years. Not a pleasant thing for parent or child, but necessary for a whole host of reasons. And as a mom, it was an absolute priority for me that both of our boys received their routine vaccinations. And yet Alaska traditionally has been the lowest. We've been at the bottom of all 50 states when it comes to the percent of those who have received their vaccinations. And I suppose you can say, well, Some of it is related to access. Some of it is uh, not being in a position to have good information about vaccines. But um, I, I'd like to hear from your perspective as we think about uh, children's vaccinations and the importance of children getting their vaccinations, not only to protect them, but to protect others. You know, whatever the outbreak may be. It was just last year, I think, that there was a measles outbreak in the Seattle area, in Washington, and just that rate of transmission. But can you speak to the situation here in Alaska, and why we may be dealing with what they call vaccine hesitancy, and what it means for Alaska's kids?
Yeah, that's a great question. And, as a parent, I get it. Like when, my perfect kid who could do nothing wrong is sitting in my lap and smiling and cooing, and I've got a nurse coming at her with a bunch of large needles. It's like
Mhm.
intuitively very like, doesn't
Yeah,
feel
stay
right.
away. Yeah,
Stay away. Like, do not poke my child. Like, what
yeah.
is this? And so I can totally understand the reason for vaccine hesitancy in so many ways. And I think, it just, even as a parent, the balance that I had to remind myself, and not every parent has this advantage, is seeing kids in the emergency department struggling to breathe because of influenza, because of other vaccine preventable diseases. And having parents say to me, I would do anything to have protected my kid, and I didn't realize that I hadn't protected them. And I never wanted to be in that situation. And until you see your child suffering and struggling, it's miserable. And we we get used to, if my kid's going to throw a temper tantrum if I take away that candy, but it's going to be the right thing for them. My kid might
Mhm.
cry when I poke them when they get their vaccine, but it's the right thing to do to protect their health and the health of the community. There's probably no single thing that we do in medicine that has been as well studied, as well as so effective as vaccines, except for maybe clean water. So, I think that making
Yeah,
sure we have clean water
yeah.
is a hugely important thing. But after that, vaccines are probably next up there.
Mhm.
And we have been so successful at suppressing these diseases that we don't see them. And so we don't see the risk of them. And it's because we don't see and feel that risk that it's hard to see the need for prevention. But
Well, and we know that things were set back a little bit due to COVID. You didn't have, first of all, the ability to go in to get some of the routine medical care. But I know for a period there, we saw the rate of childhood vaccinations just kind of dropping off, but it sounds like that's coming back on track. Is that a fair statement?
Yeah, it's a great statement. So in April, we did have like a 49% decrease in regular childhood immunizations, which was highly concerning.
Uh-huh.
Slowly, that's coming back up. So like for September, we're 17% over what we would normally see this month. And in general, I mentioned like a 39% increase in flu vaccine overall. It's important to remember so we have 65% of children do get all their vaccines by the age of 35 months. So many people are doing this. Many
Good.
people are doing it successfully and doing it well, but we still have a long ways to go, as you mentioned. I also big shout out to the healthcare providers in the state who have figured out unique ways. So we've seen drive-through childhood immunizations for
Yeah.
parents who are concerned about
Yeah.
coming in. Flu vaccine's been successful that way. A lot of free drive-throughs, or we've been seeing, pediatric offices offering flu vaccine for both parents and kids, or now pharmacies offering routine immunizations outside of the pediatric office. So we're seeing non-traditional ways of making sure both flu and childhood immunizations happen, which I think will help make it more accessible regardless of where people are getting their care and for what reason.
That's good. I mean, because access it may be easier in Anchorage, but hey, if you don't have the transportation, if if you have issues between work and school, it's easy to not go forward and take that step. And then of course you have greater challenges to access if you live in outlying areas. Mm-hmm. So I want to wrap up our conversation here by talking about what we're all waiting for, and that is the vaccine for COVID. Lots of effort in an incredible way. We've got Operation Warp Speed that's moving forward to try to advance a vaccine quickly, but to do it safely. And again, to the issue of vaccine hesitancy. If people think that this vaccine has been too rushed, if it is not safe, there's going to be kind of a wait and see. And if what we're really trying to do is arrest this COVID virus, then a safe, effective vaccine is going to be important, but making sure that people take that vaccine is going to be a priority. It has been really discouraging for me. I sit on the HELP committee, and to see how the vaccine and the process towards a vaccine has become viewed as political. It should never be political. This should be a matter of science and research and the best, most brilliant minds coming together, really designing a vaccine to save lives. So we're working to make sure that through the process, there's transparency in the development of the vaccine. And again, making sure that there's a level of public trust so that when we do receive the vaccine, there is that imperative there. So talk, if you will, about where you understand we are in the process. We're told that by the end of this year, there will be vaccine available here in this country to vaccinate the most vulnerable, but that it will still be a matter of several months, maybe many months, until we see it in the general population. So if you want to touch on where we are with the COVID vaccine and what we see going forward and how we can ensure and instill that public confidence in folks.
Yeah, no, I appreciate that question. And I think you're exactly right. It has to be safe. That's the number one thing. Right. And then efficacious. It needs to work. Like we talked about flu, it doesn't have to work perfectly to be useful. And so that's okay. There may be some additional steps that need to be taken in combination, but we want to make sure it's number one, safe, and then two, that it is efficacious. It is very reassuring to see that both the Pfizer and Moderna vaccines have completed their enrollment. They've also completed their enrollment with a diverse population, including many people who have underlying health factors for COVID. So that is great to see in that. So it's really important. I met with General Perina last week, actually this week, it's been a long week, and he mentioned, and he said that the independent ACIP committee who does the vaccine recommendations will be reviewing data at the same time as the FDA. And so that was great to hear this dual process. It's not traditionally how it goes. FDA does it and then AICP does it. I don't think it compromises it. In fact, I think it's better to have these two being able to do it at the same time and having that independent review of the data. So from a state perspective, that's fantastic to see and to hear. I really appreciate the kind of rapid production so that once we know there's a safe and effective vaccine, we're not waiting on production to get it out. Right. And from the state perspective, we are preparing and being ready to vaccinate and to be able to move out quickly once vaccine is available. We've set up essentially almost like a department for vaccination. We have 8 subgroups, and we're doing it in parallel with ANTHC. While we know the Alaska Native population is 15% of our population, 50% of our test sites are run via some sort of tribal entity. Many of our rural communities, that's just where people get care and how people get care. Mm-hmm. And so the same is going to be true with vaccine. And so having a really close partnership there, particularly as we're thinking about really complex distribution, ultra cold storage, timing, multiple vaccines, all of these challenges on the logistics end, we want to make sure that the logistics isn't the limiting factor. and then we're able to rapidly get vaccine out to those who want it. So there's a lot of promise. We've been told by the end of this month, we need to be ready to go. That doesn't mean it's going to be here. As you mentioned, I think it's going to be very constrained at the beginning. It's going to be very limited. It's going to take a bit to get it up and about. And I think that as we have already seen a decrease in the chance that you die from COVID or become hospitalized from COVID, as we've gotten better with treatment options, as we've gotten better understanding masks, as we've gotten better at minimizing the impacts of COVID, I think the same is going to happen with the vaccine. We're going to see better and better numbers when more and more people are able to get COVID vaccine. We're committed to the health and safety of Alaskans. Our team are all Alaskans. We all live here. We all work here. Our families do too. And, encourage Alaskans to join our Science Echo or our Vaccine Echo, where we share the daily updates on that information and we summarize it weekly. So we really want to make sure that Alaskans are informed of what we're seeing. And we promise to share good news and bad news. Science is just science. And we want to make sure that the information is transparent and timely and available for Alaskans.
Well, and I think that is a really important aspect of what we're all involved in. COVID-19 is new for all of us, and so when something is new, the best thing that we can do is share full information, even information that we would really rather, and we don't like that information, but we have to have a full understanding as to what we're dealing with. And the same holds true, I think, with a vaccine. Mm-hmm. And so the level of transparency, again, a pretty expedited process, but I think that that's just a testament of the focus, the priority that we have placed on addressing this. But it's one thing for the scientists and all those who have been working so hard to develop that vaccine. It's very important, but then it needs to be able to translate to an acceptance and a willingness then to be vaccinated, just as we do with the flu. It is obviously voluntary, but understanding that it's not only going to be helpful to you, but to those around you. And as we look to what has happened with those families who have perhaps parents or elderly relatives in some of our nursing homes or the pioneer homes, and the fact that we haven't been able to have that human contact with them in so many of our schools are not live and in person, but they're virtual, and how we will get back to school and sports and supporting our restaurants and our businesses. I think this all comes about when we get on the other side of this coronavirus, when we are able to say, we got this, we're on top of it, and we're going the right direction. And I think that comes with a safe vaccine that will help us rebuild that confidence. So we look to professionals like you to help communicate clearly the need, and again, to reinforce that, well, it may not be 100% effective. We can't guarantee that. What we are trying to do is make sure that if you should contract the virus, that you're going to have a better likelihood of moving through it and slowing down the spread amongst other people. So it's an important message that we're talking about today, not only as it relates to the COVID virus, the COVID vaccine and what we need to look forward to, but just vaccines in general. Mm-hmm. When you think about our Iditarod, that whole fabulous, wonderful 1,000-mile race came about because you had a means of transportation that was willing to go forward in some pretty awful conditions to help save lives in the community of Nome when they needed a vital serum for the diphtheria that was moving through that community like wildfire. So we've got a history, a special history with vaccines, and hopefully we're going to be talking about COVID-19 in past tense and what we learned from it, the resilience, but also perhaps greater appreciation for the medical professionals who every day are out there on the front lines working for all of us like you. So thank you for what you do in your leadership.
Well, thank you. I couldn't agree more. I mean, the enemy is the virus. It's not each other. And the more that we can all collectively work against that, all of these public health measures are simply for the health and well-being of Alaskans. We want schools open. We want businesses open. I miss my family. I can't wait to give my friends a hug. We are in it with you. And the more that we can collectively stand in this space together. And as you mentioned, we have a long history of getting treatment and vaccines out. We have a long history of being really affected by previous pandemics and epidemics. And this pandemic doesn't happen to us. This virus can't live without our bodies allowing it to replicate. And so we make a choice to allow it to spread from person to person. And we can choose our future with this pandemic. And we can choose what our family and our kids are going to say about this 20 years, 50 years, 100 years down the road on how we responded to this pandemic. And so I think this is Alaska's choice on how we choose to write our history, and our time is now to act.
Well, let's all choose responsibility here, and it begins with each of us. But thank you for making sure that Alaskans have clear guidelines and know what it is that we need to be doing. So again, thank you for your leadership, and I know you have a great and a strong team. From the commissioner down to those who are working in the epidemiology department and the virology labs, everybody who is engaged in this has been pulling real hard for a long time, and we just appreciate all of their efforts. So thanks for being part of this conversation. I think it's important, and hopefully it answers some questions that some people may have. But we look forward to the vaccine, and look forward to getting on top of COVID.
Yeah, thanks for the opportunity to come, and yeah, agree. Thanks to the team, and thanks to all Alaskans for all the work they're doing.
Good. All right, everybody, take care. Thanks. Bye.